Hello everyone, myself Dr. Abhilash, laparoscopic surgeon from Himagiri Hospitals, Gachibowli, Hyderabad. In this video, in our previous videos, we have discussed a lot about the benefits of laparoscopic surgery over open surgery. But in this video, we are going to demonstrate in live the benefits, how open surgery will be performed and how a laparoscopic surgery will be performed on a virtual model. For example, this is the patient's abdomen, the belly part, and if patient has got multiple stones or worms kind of, so this is a replica of the stones. We can see a few rice grains inside the abdomen, and consider these unfilled balloons as worms. So this patient requires a surgery for this stone removal or this worms removal. So how exactly a surgery will be performed and what are all the differences between a laparoscopic surgery and an open surgery? To start with, suppose this is the abdomen, and what happens or what we generally do in an open surgery is, with a knife we will be making a long incision over the patient abdomen, and after making an incision we have to split open the muscles to have an access into the abdomen, and thereby we will be inserting a hand and we will be removing the worms or the stones as per the requirement. This is what we do in a conventional open surgery. And what happens and what is the result of this open surgery? Patient will be left with a very long incision, and that incision has to be closed with sutures, and after getting discharged, patient needs to have a regular dressings of the wound so that it won't get infected, and later once the wound is completely healed, he needs to come back for suture, that stitches removal. But how exactly a laparoscopic surgery is performed and what are all the advantages of laparoscopic surgery over open surgery? So what are all instruments that are used in laparoscopic surgery? Unlike these knives which are conventionally used in open surgeries, what we do in a laparoscopic surgery is, we do have these are called as trocars, and these are the laparoscopic instruments. How these actually help is, generally in conventional open surgeries, we need to grasp or do the surgery with a surgeon's hand. Whereas in laparoscopic surgery, there won't be any contact of the surgeon's hands with the abdominal organs. But how exactly we are able to do the surgery? Because of help of these laparoscopic instruments. How actually these laparoscopic instruments help, we can see. So just like a human hand, with these laparoscopic instruments, we are able to open or close, open, catch, close, and lift it up, and we will be able to remove it. Likewise, we do have many laparoscopic instruments even for suturing, cutting, etc., to control the blood loss or not. And how large these instruments will be? If you look at or a side-by-side comparison, this is the normally generally used pen, and this is the one of the laparoscopic instruments which we generally use. So if you look at the diameter of the pen and the diameter of the laparoscopy instruments we generally use, this is much thinner than the normally used pen, and the incision which will be you will be left after a laparoscopic surgery may vary from 0.5 to 1 centimeter only. But how exactly a laparoscopic surgery will be performed? If you see, so consider just this is the abdomen. In open surgery, what we have done is we have made a long incision to have an access into the abdominal cavity. Whereas in laparoscopic surgery, instead of cutting open, what we'll be doing is, through a 1 centimeter incision, we'll be placing something called as a trocar into the abdomen, and through this trocar, we will be introducing the laparoscopic camera, and this is how a camera actually appears. You can see this is one of the reputed companies, the internationally renowned camera, because this camera quality actually decides the outcomes of the surgery. The better the camera clarity, better will be the surgery and the comfort for the surgeon. So this laparoscopic surgery, in this camera will be introduced into the abdomen, and to know, so through this laparoscopic camera, this camera will be connected to the monitor, and to demonstrate what exactly is happening inside the abdomen, we will be connecting it to a monitor. So the same rice grain which we have seen earlier, you can see how big it appears. So through this laparoscopy, even the small grain is appearing literally as long as my index finger. So this is the advantage of laparoscopy. If we side by side compare, the small rice grain which was seen inside is nowhere compared to my length of the index finger. Through this laparoscopic camera system, even the smallest rice grain will appear 15-fold or 20-fold increase in size in laparoscopy. So because of this advanced technology, the emergence of complications also in laparoscopic surgery is far low compared to open surgery, because we do have a detailed vision of the abdominal organs through laparoscopy. So in laparoscopy surgery, generally we minimum require 3 ports. One port will be for the camera. Through this camera only we'll be able to connect to the monitor, and the rest 2 will be the working ports. So through this vision only, these are the right and left hands of the surgeon, and these instruments will be guided by the camera. For example, if at all we have to remove the small stone which is there inside, through this camera only, through this laparoscopy instruments, we will be able to catch the stone. Through laparoscopy, we will be able to catch some small stones, and we will be able to remove it. So we will be able to remove the small stones from inside. So now you can compare the advantages of laparoscopy over open surgery. So this is the stone removed. In the same way, if at all there is a worm in the abdomen, if at all we want to remove also, instead of cutting open, we can catch it with laparoscopy, and through laparoscopy only we can be able to remove it from inside in the same way as demonstrated. So without cutting, we will be able to remove the complete worm in this way. So to remove such small worms, instead of cutting open, through this small holes only, we are able to even remove such long worms, and this is the beauty of laparoscopy. So to put it in a nutshell, what are the advantages of laparoscopy unlike in open surgery? In laparoscopic surgery, we don't have a major cuts. What all we'll be having is a 0.5 to 1 centimeter incision. The incision is small, so we need not place any stitches or sutures to close the incision. We will be placing something called as skin glue. It's just like Fevicol for the skin. So that is the replacement for the stitches. And the incision is small, so the blood loss will be less and the pain will be less. Patient can walk on the same day, patient can have diet on the same day, and immediately, if most of the laparoscopic surgeries will be day care surgeries, patient can get discharged on the same day of surgery when it is done through laparoscopy surgery, provided he has got no major comorbid illnesses and patient is of young age. And after going home, there won't be any need for dressings or suture removals per se. Patient can resume their normal activities or return to their work much earlier compared to open surgeries.